Good morning, friends. Welcome to our next learning session. And this is the incidence of 1976. Somewhere in the later part of the year, a gentleman rang my bell at about 1:30 p.m. I was on the dining table about to start my lunch. I came out and asked him what is the problem. He said, "Doctor, I have pain in my jaw." So this is not an emergency. I asked him, "Can you sit down and wait for 10 minutes so that I can finish my lunch and attend you?" He said, "Doctor, I work in a bank. I have been transferred from Goa to Delhi. I have just shifted to a house opposite your house. I will also go and take the lunch and come back for examination." So I sent him back, and when he came back, he asked me, "Doctor, is there anything to worry about it?" I asked him, "Is there any history of heart attack?" He said, "No." "Is there any history of hypertension in the family?" He says, "No." He said, "Yes, my elder brother has got hypertension." I said, "About diabetes?" He said, I myself suffer from diabetes." So I told him that this is sufficient to warrant an ECG before we do anything else. So I made him lie down, recorded his blood pressure. It was 160 by 90 millimeter of mercury. Then I started recording the ECG. After recording first 6 leads, that is lead 1, 2, 3, AVR, AVL and AVF. He said that, "Doctor, I am sweating profusely. Can you switch on the cooler?" I switched on the cooler, but cautioned. I recorded his blood pressure again, and it was now 90 by 60 millimeter of mercury. There was a straightforward fall of 70 millimeter of mercury, which was the cause of his sweating. In the ECG, lead 3 and AV were showing deformed T waves, so I repeated these leads again, and now there was a clear-cut evidence of inferior wall myocardial infarction. So I told him that this is the situation. You have got an heart attack and you require to be hospitalized. How you will like to go? You are in a bank. Do you have a system of reimbursement? Because in private field it is going to be a little expensive procedure. That time in 1976, single room in a private nursing home of good repute would cost about 200 rupees per day, only room rent, plus other things all put together about 500 or 600 rupees per day. And it is a lengthy thing because he will have to stay there for 2 to 3 weeks in the nursing home. He agreed. He said that he has got some reimbursement system, therefore he would not mind in getting admitted. I admitted him and started monitoring his vital functions. He fortunately showed good recovery and was very cooperative patient. I controlled his diabetes. I kept his blood pressure under control, and in the first week I kept him on total bed rest. In the second week I gave him bathroom facilities and movement in the room only, and in the third week I permitted him to move about in the nursing home, but not exerting. After 3 weeks I discharged him and told him he was staying, I'm sorry, I forgot to tell you that he was staying on the first floor. So when I discharged him, told him not to exert. You can move about in the house, but for another 3 weeks you should not be doing any exertion or should not get into any emotional problems. As I said, he was a very cooperative patient. He cooperated with that and made full recovery. So what was this heart attack? See this ECG. This is the baseline which I have marked with my pencil. This is the baseline. Anything above or below this baseline becomes abnormal. Now this is called ST segment. This is the ST segment, and this is above this baseline. This segment should have been here, but it is so much up. Here in all these leads it is showing that ST segment has gone up. This is called elevated ST segment, and this is abnormal. This is what suggests a myocardial infarction. See very closely to the I bring this strip very close to the computer so that you can make out that this is how much raised from this area. It is gone here. This is the abnormal. See, this is the abnormal thing, and this is what is called myocardial infarction. So friends, can Japan pain be a myocardial infarction? Typically, pain of myocardial infarction occurs in the retrosternal or substernal area, that is the area of the chest behind the breastbone. The pain is like heaviness or crushing or squeezing. This is a very severe pain. It is usually accompanied by sweating and maybe giddiness. There may be nausea and vomiting also, and pain sometimes radiates through the left arm, but this is not a must feature. Sometimes pain occurs in atypical locations. For example, instead of pain occurring in the substernal region, the pain may occur only in the left upper arm or left forearm or fingers of the left hand. The pain may occur in the throat, in the neck, or in the jaw, or the pain may occur in the back, and very occasionally pain may occur in the right arm or even right fingers. All these variable descriptions have been described in the textbook of cardiology by Charles Friedberg, and we had read this book during our post-graduation at All Institute of Medical Sciences. That helped me to arrive at a diagnosis. I was happy that this patient made full recovery, and he remained in Delhi for 3 years. And after 3 years, one day suddenly somebody gave a ring at my door, and when I went out, it was this gentleman. He said, "Doctor, I've been transferred back to Goa. I am just leaving. My son and wife are in the car, but I stayed out to say thanks to you, because there are certain things in life which you can never forget, and I can never forget you, that you saved my life." I think there cannot be better compliment to a doctor than this. I felt very happy. I walked him to the car and bid them farewell to the entire family. And friends, thank you very much for listening to me, and I hope you will also take advantage of this type of experience.